Hey everyone, it's Zach with Palantir Research. We've got a huge announcement for Palantir's healthcare endeavors. We've got the announcement of a new platform built in partnership with Concordance Healthcare Solutions, and that's to help manage supply chains. And I'll go over what will make this so valuable. So first, for context, there's a previous article released back in October 3rd, 2022, that's just announcing the partnership, essentially stating that these two are partnering up to build this ecosystem for medical supply chains. And they've released just what that platform is, and it's called Surgence. It's a healthcare supply chain ecosystem that fully connects providers, distributors, and suppliers together. That's so you can get an actual real-time visibility into the supply and demand for these medical supplies. I've talked about this exact thing before with the Japan electronic usage of the Athenia platform. This provides everyone in the supply chain the ability to share data that they want to, of course, securely, and that's to showcase what they need, and this is going to be to everyone's advantage here to plan out what they need to do. So the aim is to optimize healthcare supply chains so medical supplies can flow more easily and in turn improve patient care, which I believe should be the goal. And of course, helping your profits and margins is a side note. So think of a provider or hospital, and they may have a demand for a specific set of surgeries coming up and also a certain level of normal expected surgeries that may happen in emergencies. This kind of data would flow into the platform and allow visibility to the distributor and suppliers to understand what is needed down the line so the distributor can expect some stuffs to come through and possibly a small influx if any irregularities come through. And this helps the supplier also try to ramp up or even slow down production if needed, or of course reprioritize towards something else if they expect that to be there. And it can work in either direction, of course, or start in the middle. I think the biggest advantage, though, is the ability to see big irregularities or shocks to the system. Of course, there's a big one like a pandemic, but possibly just a smaller outbreak in a concentrated area of the country, possibly. That might temporarily change the flow of medical supplies in an area, which in turn can affect other parts of the country or at least surrounding ones if efforts are just concentrated over there. So now in the end, they're trying to get as many healthcare entities as much as possible on the platform, which requires them to actually get value. So this is just the announcement of the platform launching. So if they can muster up interest, we don't know if there's probably some people who are starting it out or piloting it, but it truly relies on the network effects to be valuable because you need providers, distributors, and suppliers on there. And if any of the pieces are missing or lacking in comparison, then the value that the other participating parties get won't be as great. So it may take time to actually have this scale up, have an effect, but I believe the ability to get real-time info to help your own supply chain processes should be some motivation to give some interest there. So what are my thoughts though on all this? While healthcare is a growing area for Palantir, especially in the United States, they're working with one of the most reputable clients in the world, Cleveland Clinic, and anyone who works in healthcare technology would love to get a contract with them just for the reputation alone. And they're also working with other providers, of course, that are large like HCA Healthcare and also Tampa Bay General, which is going to be in that Florida area. So they have that side of providers, and I wouldn't be surprised if they've got some connection to this. Maybe it's just a partial set of data. Now, on the supplier side or the distributor side here, we've already had announcements as well. I know I brought up OMI, which is Owens & Minor. So that's a very small distributor there, just so you know. So it's not necessarily going to be the whole thing for the country. But we also got Cardinal Health, and they are very big as well in the supply chain process. So this is something to look out for now, similar in the Athenia and Skywise platforms, where if we see more announcements of people joining the platform, the better the platform is performing, but also the more valuable it will become now to future customers because there's people actually using it, sharing their data there. It all follows that network effect cycle, of course, relying on users and value compounding over time. And then in the end, it creates a positive self-feeding loop. So this makes me very optimistic considering this is a healthcare deal and another step towards their success in this industry. But what are your thoughts on all this? Let me know below, and I'll see you in the next video.